If you're over 60 and you've started feeling tightness, stiffness, or swelling in your knees, this is for you. In the next few minutes, we'll go step by step through gentle, science-backed movements that help your body drain swelling naturally and regain pain-free knee mobility. No impact, no strain, just smart movement designed for your stage of life. Now, take a deep breath, sit comfortably, and let's begin. Imagine standing up from your favorite chair just like any other day. But this time, your knee sends you a sharp, unwelcome message. A tightness, a throbbing, a deep swelling, a feeling like something inside simply doesn't want to move. Suddenly, every single step feels heavier, slower, and significantly less free. This is a quiet thief of your functional independence. The common truth is this: most people struggling with knee pain are told to rest more or rely on a pill. But the long-term answer isn't less movement. It is the right kind of movement. We need gentle, specific movements that awaken your body's natural lymphatic drainage system. Movements that help your stiff knees stop fighting and start flowing again. In this powerful video, I'm handing you 5 essential, clinically backed tools to take back your mobility, your foundational strength, and your everyday confidence. I will explain the biological reasons why they work. And the final technique is a little-known patellar mobilization method I'm sharing with you today. Before we get started, drop your name and where you're watching from in the comments. We often view healing as passive, waiting for swelling to go away. But your body needs gentle, purposeful motion, and critically, gravity applied correctly. When fluid, edema, builds up in the knee joint, it signals that your body's drainage system is completely stalled. Your calves, ankles, and feet act as crucial natural pumps for your lymphatic and venous systems. When you move, these pumps activate, moving fluid back toward the heart. The problem is, most people with knee pain stop moving, and the fluid stays stubbornly stuck. This first exercise, supported leg elevation with micro-movements, uses passive elevation and active ankle pumps to successfully reactivate your circulation and gently drain fluid away from the knee. No squats, no stress, just a smart restart. How to do it. Lie flat on your back. Place your legs up on a couch or stack of pillows so your knees are slightly bent and your feet are distinctly higher than your hip joint. The pump. Slowly point your toes away, plantar flexion. Then gently flex them back toward your body. Dorsiflexion. Do this gently and rhythmically, alternating both feet. Repetitions and focus. Aim for 25 smooth repetitions per leg. Breathing naturally. You should feel a soft, rhythmic squeeze in your calves. That is the pump in action. Tip: perform this once or twice daily, especially in the evening, to effectively ease heaviness or swelling after long periods of sitting or standing. When fluid builds up inside the joint capsule, it acts like glue, making your knee feel tight or functionally frozen. The stiffness comes rapidly from inactivity. Your knee is designed to glide smoothly. This second movement is designed to gently unlock that rhythm. We utilize gravity and target the posterior chain, hamstrings, and calves to pull fluid away from the joint and retrain flexibility. By raising your leg and slowly extending the knee, you trigger mechanical lymphatic flow, a natural suction created by the gradual lengthening of the soft tissues behind the joint. How to do it. Lie flat on your back. Bend one knee with that foot resting flat on the floor. Protects your lower back. The stretch. Raise the opposite leg straight. Use a towel or strap to gently hold the back of your thigh. From this position, extend your knee slowly, reaching your heel toward the ceiling. Do not force the stretch. Stop at light tension. Activation. Flex your foot toward your face as you stretch to engage the full posterior leg line. Reps and breath. Repeat this motion for 10-15 reps per leg, holding each extension for 3 to 5 seconds. Breathe deeply. Practice daily to systematically increase flexibility and drain pooling fluid. Behind every stable knee is the powerful quadriceps muscle, the guardian of your knee joint. When inflammation sets in, this guardian often falls asleep. The knee becomes unstable and flooded. The quadriceps helps pump excess synovial fluid out of the area. When the quad is inactive due to disuse, your knee literally can't pump out the swelling on its own. This exercise, isometric quadriceps contraction, is a quiet powerhouse. You are deliberately not moving the joint. You are simply pressing and holding. Yet, you activate muscle fibers that trigger neuromuscular wake-up and jumpstart the fluid dynamics inside the knee. Studies confirm that regular isometric contractions can significantly reduce intra-articular pressure and increase proprioception, joint stability sense. How to do it? Sit or lie down with one leg fully extended. Place a rolled-up towel or small pillow directly under your knee barrier for support. The hold. Press your knee down firmly into the towel as if you are trying to gently flatten it. You should feel your entire thigh muscle, quadriceps, visibly tighten. Duration and reps. Hold this contraction for 5 seconds, then slowly release. Repeat this for 3 sets of 10 repetitions per leg. Tip: practice this daily, especially in the morning or just before walking, to build strength, improve essential drainage, and swiftly restore stability to the knee joint. This move is focused on rebuilding your foundational power carefully and safely. The straight leg raise strengthens the quadriceps, effectively stabilizes the hip, and mobilizes the knee joint, all without causing direct compressive pressure inside the joint itself. It strengthens your hip flexors, activates core stability, and triggers enhanced circulation throughout the entire lower limb. How to do it? Lie on your back. Bend one knee and plant that foot flat on the floor. Protects your lower back. The lift. With the other leg straight, perform a quick quadriceps set, like exercise 3, and slowly raise the leg to approximately the height of your bent knee. Hold for 3 to 5 seconds, then lower the leg back down with slow, deliberate control. Reps in safety. Perform 3 sets of 10 to 12 repetitions per leg. Crucially, your back must stay completely flat. Do not arch. Keep your core lightly engaged throughout. Most people ignore the front of their knee. Behind that swollen, stiff feeling is often a stuck patella, kneecap, surrounded by congested fluid, tight fascia, and microscopic adhesions that restrict mobility. Your hands can become one of the most powerful healing tools you have. Through gentle manual massage and patellar mobilization, you achieve 3 vital therapeutic outcomes. 1. Stimulating blood flow. 2. Encouraging lymphatic drainage by physically guiding fluid out. And 3. Releasing small adhesions that limit your knee's glide. How to do it? The private technique. Sit on a firm surface with your leg extended and fully relaxed. Place your thumbs gently below the kneecap. Phase 1. Warming, drainage. Start with gentle circular motions around the patella, moving the soft tissue for 30 seconds. Next, using your fingers, glide firmly upward from the top of the shin toward the thigh, guiding excess fluid up. Phase 2, mobilization. Now, gently try to move your kneecap, patella, up, down, and side to side. These movements must be tiny, soft, and unforced. Closing ritual. Finish with full hand circular strokes. Practice this daily after your exercises. This small ritual makes a big difference in both swelling and how safe and trusting your knee feels to move again. Real-world advice for older adults. Progress does not come from perfection. It comes from unwavering patience. Your body responds far more favorably to consistency than it does to sudden intensity. What genuinely matters is that you keep showing up. Remember, pain is never a failure. It is simply your body's feedback. Trust that healing is always happening when you move with focused care and intention. If you stay consistent, treat your body not like a worn-out machine but like a cherished old friend, it will respond, slowly, then suddenly. One day soon, you'll notice that the stairs don't seem so steep, and you will walk longer and move with more undeniable trust. If this video helped you, please leave a comment below. Your story might be the hope someone else needs today. You deserve to move freely. You are not alone on this path. Let's keep walking, one mindful, safe step at a time. Comment below. Which of these 5 gentle moves felt the most effective for you? Subscribe to Senior Fitness Guide for daily science-backed exercises that help you stay strong, balanced, and confident after 60. Turn on notifications so you never miss a new routine designed for your independence. The information in this video is for educational purposes only and not a substitute for professional medical advice. Always consult your healthcare provider before beginning any new exercise or mobility program.